morning, everyone. I'm Rebecca Vickers, and on behalf of the Florida Alcohol and Drug Abuse Association, welcome to today's webinar. This webinar is being made available through a collaboration of the Florida Department of Children and Families, Office of Substance Abuse and Mental Health, and the Florida Alcohol and Drug Abuse Association. Please note that as an attendee, you are in listen-only mode and will only be able to view your name. If you have questions, please send them to the presenter and use all panelists by opening the chat panel. The button to open the panel is usually located in the upper or lower right side of your monitor. Please use the chat panel to send any questions you may have as you think of them, and the presenter will address questions as time permits. Audio is broadcast through the internet to your computer. If you experience poor computer audio, there are a few options to try on screen right now, and these options are posted in the chat panel. If you continue to experience poor audio through your computer, try rejoining the webinar and use the I will call in telephone option. You must be connected to the audio of this presentation and view it on screen as well to receive a certificate of attendance. The recording and materials used in today's presentation will be available on FADA's website within 30 business days. To access the recording and PowerPoint, go to www.fada.org, then to our Resource Center and onto our training library. FADA produces many webinars and workshops through the support of the Florida Department of Children and Families. To help participants track credits earned through attendance, we host an online community that provides a personalized digital journal where participants can maintain statements of credit for webinars and workshops taken through the Florida Alcohol and Drug Abuse Association. At the end of today's webinar, the web browser will direct everyone to an evaluation form on FADA's website. You will first need to register or sign into your account to complete the evaluation. Information you provide FADA as a part of registration remains confidential. Statements of credit will be posted 30 business days after the evaluation closes for persons completing the evaluation and attending the full webinar. Please remember that completing the evaluation is necessary to receive CE credits or to access your statement of credit. Please note that the evaluation will close midnight, Wednesday, February 15th. Up to 2 continuing education credits are available for participating in today's webinar. For persons licensed through the Board of Nursing, the Board of Clinical Social Work, Marriage and Family Therapy, and Mental Health Counseling, and for persons credentialed through the Florida Certification Board. If you are a licensed healthcare practitioner, you needed to include your Florida license numbers for reporting to CE Broker when you registered for this webinar. If you are certified with the Florida Certification Board or licensed outside of the state of Florida, you do not need to provide your certification number when you register with our site. Please note that WebEx monitors arrivals and departures of attendees and provides a report upon completion of the event. We are not permitted to provide a certificate of attendance if you do not attend the entire webinar, and we are not permitted to provide partial CE credit. And now I'd like to introduce our presenter for today, Kathleen Roberts, Chief Executive Officer for the Community Coalition Alliance. She has more than 15 years of experience in behavioral health at the local, regional, and state levels. In her role at CCA, she works with community coalitions, providers, and partners to assess substance use trends through data collection and analysis, conduct research, partner engagement, capacity building, and community assessments. Ms. Roberts also provides ongoing technical assistance and training and serves as a master trainer for Florida with the Substance Abuse Prevention Skills Training curriculum supported by the Substance Abuse and Mental Health Services Administration. Prior to joining CCA, she worked with the Florida Department of Children and Families, Office of Substance Abuse and Mental Health, serving as the clinical team lead, Florida's National Prevention Network designee, and State Epidemiology Work Group lead. She received her Master's of Science in Criminology from Florida State University and a Master's in Science in Criminal Justice from the University of Central Florida. And now I'd like to turn the presentation over to you, Kathleen.
Excellent. Thank you so much. Can you hear me all right?
Yes, you sound great.
Perfect. Well, thank you. And good morning, everybody. Thank you so much for taking the time to join us here today. We're excited to be able to talk a little bit about selecting the right prevention approach for your target population. Now more than ever, we have to be very intentional with what we are trying to do across our communities because our substance use issues continues to grow. So the more we can do that follows in line with what research shows us and what the data supports, the more likely we are to see the positive outcomes we're striving to aim for. So today, that's what we're going to be focusing in on. And I'm excited to have this opportunity. Thank you to FATA and thank you to the Department of Children and Families for allowing us the opportunity to share on here. Before we get started, I want to share a little bit about who we are at CCA, the Community Coalition Alliance. Our mission of CCA is to serve as that collective voice of community coalitions working towards the health and wellness of all Floridians. We bring together coalitions as well as community partners from across various communities, both rural and urban, similar and different, to allow us the opportunities to leverage our efforts, our ideas, and our opportunities. By having all of us work together, we're able to create that unified voice. We're able to problem solve together, and we're able to identify what are the best practices out to better assist our communities. At CCA, we have a couple of different roles that we play by providing this opportunity for our members to come together. We serve as an opportunity to bring membership so that all of our different coalitions and community partners can come together to have an opportunity to brainstorm and discuss ideas, opportunities, and barriers. We also provide funding and oversights. We're able to contract with the managing entity from our Northeast region, LSF Health Systems, to allow the opportunity for community level prevention to take place across the Northeast region. We also have funding that comes in from the different federal or opportunities, and we help to look across the community needs to identify what are the things that we need to build in and bridge with all the different partners at the table. We also work a lot to providing technical assistance and training. Key to the success of prevention is ongoing work around the workforce enhancement and development. Research continues to get updated all the time, so we need to make sure that those out in the community working across our field have the latest and greatest information available, access to the trends that we're seeing, and so that we're always trying to get ahead of the situation and not fall behind. We also have an opportunity to do a lot of partnership engagement by working with various organizations to assist us with access to data that sometimes is difficult to get, access to resources that allow us to use the funding we do have to go more into services and allow these opportunities of resources to leverage and supplement those things. And we also have opportunities to network with other organizations. Some of our key partnerships include the North Florida HIDA, High Intensity Drug Trafficking Area, Project Opioid in the Jacksonville area, as well as the Florida National Guard Drug Demand Reduction and Outreach Organization, as well as many other universities and local providers. So we're very, very excited about having all of these different groups coming together to have the opportunity to create the change together. The slide here shows you a list of some of our key members from across the Northeast and Southeast region. We cover a variety of different types of counties, rural and urban, small and large, but this allows us to have various perspectives at the table so we can really look and see what those community needs look like and how can we look to identify the resources needed as well as the services. The other thing we would love to be able to share out here today as well, today we're going to cover a key important topic. The ongoing training and ongoing discussions around these issues is very important for our workforce to continue to thrive and expand. So one of the trainings that we offer is the Substance Abuse Prevention Skills Training, which is a foundational course to understanding what is behind the arena for prevention. Prevention is a science, and with it comes the key components of what creates that success. So we use the SAMHSA curriculum, that's an evidence-based curriculum designed and developed to really focus in on that foundational understanding. As a 4-day intensive training, while it seems like that's a lot, it really provides those key components to get you to success when you're talking about prevention services. And really, what it covers and how it delivers that information, it isn't limited to just prevention, because it helps to understand a way of thinking, a way of identifying what needs to take place, and a way to follow through with the evaluation and ensuring that we are culturally competent, and as well as focus on sustainability. So our upcoming trainings that we have, free of charge to anybody that would like to attend, is coming up here in February, February 21st to the 24th in the Jacksonville area. Thanks to our partnership with the North Florida HIDA, we'll be using their location as the training site. And we're going to have Laura Hawley, our Director of Training and Education from CCA, is going to put into the chat the registration link so that if you are interested, we do have some availability still for the class. We limit the class size to about 35 individuals just because there are a lot of very intense hands-on activities that include a lot of course discussions, case scenarios, and interactive opportunities to really understand and go through into all of the different topics. We also are working to put out some mini snippets of that SAPS course throughout the year so that the training doesn't become a one and done. As we know, research continues to grow. Things that are identified need to be provided out to the different individuals and organizations in this field. So we try to bring a little bit of an additional component to it throughout the year. So if you have any questions, please email Kimberly from our team at support@ccafl.org for more information about registering for any of the upcoming training opportunities. So today we're going to get into talking a little bit more about how do we identify what is an appropriate approach for prevention, covering our key objectives here today. The first being the importance of relying on research-based and research-supported practices, programs, and strategies. Second, we're going to talk a little bit about how we go through the process of identifying and selecting practices, programs, and strategies. And lastly, we'll go through to examine how is the right fit for a target population. We know that with prevention, there's a lot of available resources out there, a lot of programs, a lot of strategies, but in order to ensure that we are doing the best that we can to get us the most likely positive outcome, we have to rely on what the available research shows us and guides us to do, and making sure that we're relying on the data that is available to us to really understand what is happening. So with that, that's what we're going to cover here today. I do encourage, if you have questions along the way, to please type it into the chat. If it's something that fits into the discussion at that moment, we'll cover it at that moment. If it's something that's going to come up later on in the presentation, we'll hold on to it for a little bit later, but we'll try to get through everybody's questions and comments throughout the way. There'll be a couple of questions we will throw back out to all of you so that we can get a little bit of that engagement going, but we'll get that a little bit later into the slide deck. So with that, we're going to get started in going into our presentation here. So the very first thing that I want to say before we even go through what do we pick, how do we pick it, is the understanding that prevention is science. And we say prevention is science because that is based on the scientific research. Prevention, just like any other scientific field, relies on the evidence that is available to be informing the decisions that we make. We look at the data, we test out different strategies, we look at different programs, we analyze the different pieces of those programs, we put them out and test them into different settings to see the effectiveness. There is a process through which we go through. Just like in the scientific method, we come up with an idea, we decide what that's going to look like. We try it out, we review it, we evaluate it, we assess it, and determine what's worked, what hasn't, update what we need to, and move forward from there. what we do is important to continue to mention that it is science-based, because it's not a field that we just throw things together. We're very intentional with what we put together. We are relying on what the research is guiding us to do, so that when people say, well, why are you doing it that way? We're doing it this way because we've evaluated this approach. We've evaluated this curriculum. We've evaluated the strategy. We know that by implementing it, but this particular manner, we're going to be most likely to see those positive outcomes. We know that the problems out there related to substance use are great. We know the funding is available, but it's not enough to cover everything needed. So if we're going to do something, we should make sure that what we identify and select to do is going to be what will get us most likely to see success. So every time that our organization hosts trainings, we begin with, we are all scientists. We are prevention scientists in this field. What we do matters and is supported by our research, and we'll continue to take this field in that manner and that approach, relying on evaluation as our key instrument to identify what is working, what is not, to improve the work that we do. So what is evidence or research base? This is what is grounded in research and scientific studies, not a personal experience. It's not that one day someone woke up and said, you know, I think it would be great for us to talk to youth about the dangers of underage drinking. It didn't just become an idea. It was intentional. There was a lot of thought put into it. There was research that we looked at to identify those needs, where the priorities are, what the gaps are, so that all of those pieces are being informed. And we're guided by what the different research studies that have been done have found. Evidence-based practice is that process that combines the well-researched interventions with clinical experience and ethics. Evidence-based programs are those programs and curriculums that have been rigorously tested in controlled settings, proven effective, and translated into practical models that are available to community-based organizations. So when we say rigorously tested, what that means is that a particular curriculum that is designed and developed is put out to test out, just like as if we were a scientist in a lab. We test it out with our population of interest. We implement as intended as the way that the curriculum was designed. We collect the data along the way, both qualitative and quantitative. We look at both of how things are implemented to the outcomes and the outputs that were developed as a result of the program. And then we look to see what worked, what did not. We use different analysis models to look and see those positive outcomes, what has been seen, and what can we learn from it. And we test this out not just one time and not just two times, but multiple times and across multiple populations and multiple geographic locations to ensure that when we say something is evidence-based, that it is supported by the evidence, because it was tested out, it was reviewed, it was assessed, and it was analyzed to show this was effective. And we do this in that setting so that we can say, this is the right recipe that we found to get us that positive outcome. So by doing X, Y, Z in this particular process, in this particular manner, we get these positive outcomes, so that we can share that back out to the field to say, if you would like to see success, if these are the different things that you're facing, if this fits the setting that you have, if this fits the population you're focusing in on, if you follow this particular recipe, you're going to be most likely to find that positive outcome. So these approaches are ensuring that, treatment and those services are used, when used as intended, will have that most effective outcome as demonstrated by research. So when someone comes back to say, well, how do you know this is going to work? Well, we have a good feeling that we have a good sense that it will work, because we've looked at the research and we've seen when this has been implemented in this approach, they're able to see reductions in substance use. They're able to see improvements in protective factors. They're able to see all of the things that we're striving to achieve, because we have that evidence that has been seen from previous attempts of implementing this. And when we say evidence-based and research informed. The evidence-based curriculums are those that have been done in studies. They've been done in controlled settings multiple times over. There have been researchers behind it to assess and analyze things using a lot of the more complicated statistical analysis components to really examine the impact of that particular program and curriculum. Research-based and informed are those things that we look at program strategies that have been informed based on the best practices out there, what the research has found, the things that have shown most likely to be successful, so that we can use that as our way to ensure what we're doing will give us the positive outcomes. And the reason this is so important is because by relying on what the research shows us, by relying on the studies that have implemented these programs, curriculums, strategies, we know that we're taking out the guesswork. We're making sure that at a time when there is limited time and limited funding, we're really going to rely on things that have the most likelihood to succeed. We also avoid unintentional consequences or the inverse effect, making sure that we are relying on things that we haven't seen any problems come out. Researchers have gone in, they've examined the whole process, they've examined the outcomes, they have examined everything that goes around to know that even though we may have good intentions, sometimes there are negative consequences, unintended consequences. So if we can rely on groups that have done these over time, over years, we feel more confident that what we're going to do is not going to bring that. This also allows us to provide insight and understanding the context of what we're working in, and it helps us to find the best fit. What is most appropriate for our community? What is most appropriate for our subpopulation we're trying to focus in on? There are so many different variations across communities and different needs and different problems. It's very beneficial that we have a body of research out there that allows us to look and see what works with my setting, what works best for what I have available, what works best for the funding that I have to work with, what works best with the different venues that we'll be going into. This makes sure that our decisions that we make are always going to be informed and not just something that we decide one day, oh, this sounds good. We don't want things that just sound good. We want things that are intentional. We want things that are supported by the research. We want to continue to show that we are the scientists that are able to move through and allow what we do to be effective in reaching our community. Right now, more than ever, we really are charged by what we're seeing in our substance use trends to do the best that we can with the best available research because the problem is continuing to grow. Right now, we can see with our data that the number one cause of death for 18 to 44-year-olds is fentanyl. That is one of the most preventable things, yet here we are, our communities are facing that struggle. We don't have time for guesswork. We need to rely on what we know is effective. We need to rely on what we know fits the populations we're trying to work with, because the issues that we're facing don't allow us to have time for guesswork. And why is this so important? Why do we continue to promote the science behind prevention of relying on the evidence-based programs, the research-informed strategies? Why do we continue to say this? Well, a lot of it comes from requirements. The requirements for funding that are coming out of federal grants, state opportunities, even private funders, is the focus around research and evidence-based, making sure that we're doing things that are going to be most likely to see that success. We want to create those positive outcomes with what is available. We want to make sure we're examining the right fits across our different target population. Not all programs are created the same. Not all strategies work with all different populations. So we need to make sure what we find, it fits the group that we're trying to focus in on. It fits the group that we're trying to work with, whether we're talking about a specific age group, ethnicity, gender. We want to incorporate all of those things into what we decide on the program strategy and effort that we've been identifying. We need to make sure we're also looking at the appropriateness. Is what we're identifying while research supported appropriate for the population we're focusing in on? Is it appropriate for the priority problem we've identified? There are so many different things that come and play a role into deciding what to implement that you have to look at beyond just, is this a good program? Well, is this a good program for the needs that we've identified? Does it have the set standards? Does it rely on the evidence? Does it focus in on this particular population we're interested in? We have to take into account all of those pieces that go into it. And over the next few slides, we're going to talk a little bit more about what are those things that we have to identify. I know maybe some of you got on here today thinking I was going to tell you exactly where online do we find the right program, the right strategy. Well, before you can even get there, you have to go through all of these pieces beforehand to making sure that you understand what your population is, the issue is, what the focus needs to be, what are the things that are driving those behaviors that you're seeing, what are the things that are influencing what is happening. Because without fully understanding your particular population, geographic area, or whatever your focus is on, you're not going to identify the right approach, the right program, the right strategy, the right effort. All of these things have to come together. And so that's, again, a reason we continue to say we as preventionists are scientists, because we need to rely on all of those components and all of those pieces to make sure we're using that to inform the decisions moving forward. Effective prevention in practice is understanding substance misuse prevention within the larger context of behavioral health. We apply what's known as the strategic prevention framework, which is a 5-step planning process that is really like a way of thinking. It allows one to go through and review the data that's available, to identify those needs and gaps, to look at the capacity, to look at the resources, to identify what's going to be a right fit for the needs you've identified, to focus in on the right priority problems, the protective factors, the risk factors, so that everything fits in together. Using that data to really inform the planning process, to focus in on and refine the prevention activities, and making sure that throughout this process, you're being culturally competent and making sure that that plays a role in the work that you do, and applying those prevention approaches that address those factors that contribute or protect against identified the problems. So all of these things we're going to go into a little bit more detail over the next few slides, but there is a lot that goes into this. Selecting a right approach, selecting a right program or strategy or activity is not as simple as that sounds. Like you go to a website, oh, here's a list, let me just pick one because those are evidence-based programs. Well, they may be evidence-based programs, but are they the right one for what you're looking into? Or is it going to fit the population you're focusing in on? All of these things have to fit in together. Otherwise, you'll just be selecting something that may or may not be effective in the work of your community. So this provides you the visual of what that strategic prevention framework is. It's a public health approach to understanding the problems related to substance use, as mental health, all of behavioral health, and really could be applied to any particular topic. It does not have to be behavioral health necessarily, because it's the process that they go through, and it is an evidence-based approach that SAMHSA has rigorously assessed and evaluated and researched to really guide the work of our field. It begins with that assessment process, moving it through to identifying the internal capacity, the resources available to inform the planning process, and that leads into implementation. And then, of course, evaluating the efforts that have been done. But throughout this whole process, keeping in mind the sustainability and cultural competence, as all of this guides the work that we do. So to guide prevention strategies, before we even get to the selection process of a particular program, strategy, or approach, it's very important that you first begin with the process of understanding and identifying the prevalence and patterns of problems and the factors that contribute to them. You need to first also identify what are those resources that you currently have? Where are those gaps? and then moving into the pieces of identifying the evidence-based strategies, the programs and efforts that will impact the change, to evaluate the work that you'll do, to ensure that what was selected, what is being implemented, is indeed making the right outcomes, is indeed helping you to see those changes that you were hoping to see throughout this process. Here, what you see in front of you is what is called the continuum of care for behavioral health. This is the design and model that was presented by the Institute of Medicine back in 1994, and really included more of that mental health intervention spectrum. But over time and in expansion, it started to include things like promotion. It started to describe the different scope of behavioral health services for individuals before, during, and after a behavioral health problem or disorder has been identified. It incorporated promotion, prevention, treatment, and maintenance. And through this, as we talk about what's the right approach, we know that there are all of these different components and segments that play a role across our continuum of care. Well, for us, we're going to be focusing in on prevention on today's call. So we're talking about everything that happens in this first section of this image here. So we'll be talking about things related to universal, selective, and indicated. So we talk about this approach of that strategic prevention framework that allows us to look at our evidence of our data and our research available to identify next steps. This will work for whether we're doing a community initiative at a larger setting, or if we're looking to implement a program within a high risk, high need setting area. The process will be the same, while the selection of what is needed will be different. But moving through this process, making it intentional, and ensuring that we're being guided by the data that is telling us about the problem, being guided by the research that shows us what is most likely to get success, that is how we're going to make sure that what our desired changes is going to actually become a reality. And we start to see that through the evaluation that we do. Throughout this process, you'll see the word promotion is listed down across the bottom, as well as that first slide. And the reason for that is that promotion is to be woven in throughout this process and really be able to focus in on addressing behavioral health in general, making sure that we're addressing it no matter where we are in this continuum of care. So I began when I mentioned about the strategic prevention framework being a public health approach. And the reason that I share this out and is because of the way that it was designed, because it's focusing in on the promotion and prevention. It's focusing in on looking at that population base. We address risk and protective factors. We look at multiple contexts. We take into consideration developmental perspective. And of course, we incorporate the planning process. I'm going to read a short little scenario to help better understand when we say you need to examine all of the components of what you're dealing with your community, because that is how you'll be able to better identify what is the appropriate and right approach for your community. Because if we only look at one piece, like if we only look at the curriculums that are designed, that are supported by research, but we don't consider all of the different intricacies of our own community, we might miss the mark there. If we look at our community, but we only look at one or two pieces of data, we don't have the full picture, we might miss the mark there as well. So making sure we're looking into all of those pieces and all of those components, that's how we identify what is really happening in your community, whether you're talking about community as a large scale community, as a county, a subsection of your county, or if you're talking about community within your school, within a specific setting and venue. All of this still takes the same process in order to understand what is happening. So I'll read this little scenario to better understand how this public health approach allows us to be able to identify what's going to be right for the issues that we're facing. When people first started settling in villages and towns, they usually chose to settle near water, ponds, lakes, and rivers. Sometimes this put them into close proximity with mosquitoes, since mosquitoes relied on water for reproduction. If some of those mosquitoes carried the germ of malaria, they infected people that they bit, causing them to get sick and die. As a result, this became a public health problem. The factors that influenced the spread of this disease were water and mosquitoes. The actions were taken to lessen the disease or problem, including draining the swamps, educating the people, and using mosquito netting at night. So I share this little scenario because this was something that was identified. People were dying. So if we take that as same example for us, opioid crisis, fentanyl, people are dying. Just knowing that people are dying doesn't help us to figure out what is the best thing for us to do to help what's going on. In the scenario that I read to you, what they identified was looking in their setting to see what are the things that they're noticing. They're noticing people are coming to the water. They're noticing mosquitoes are being drawn to areas that have water that are not clean. They're noticing people are getting infected through the mosquitoes. So going and looking at all of those pieces that are happening help to identify what can be done. Noticing that the water that was unclean was causing an issue, they began to drain swamps. Noticing that people were not aware that this was happening, of this is how people were dying, they began to educate the people. Noticing that the disease was being transmitted through mosquitoes, they began to implement those mosquito nettings at nighttime. Those are things that were identified and done, not because they just said, oh, let's try this out. They looked, they did the research, they identified to better understand the context of what was going on in that particular population. Take that back for where we are, and we look at things that we're struggling with. I will take something a little bit more simple, like underage drinking. If that is something that we see in our community as an issue, just knowing that underage drinking is a problem doesn't mean we know what can we do to address it. First, we need to understand, well, why is it happening? Where are they getting alcohol from? Where is it taking place? If we better know and answer those questions, it helps us to figure out what we do about it. Are we talking about underage drinking at high school level, at a college level, middle school level? Knowing those specific populations will also help us figure it out. If we say underage drinking is an issue, so we're going to go and pull something that's research supported, evidence based by training all of the different businesses in our community, that should fix it, because the research shows us by providing this education and training to businesses that sell alcohol, then we will reduce out underage drinking. We do all that, and then if we don't see a change, it might be because we didn't stop to think, where are young people getting alcohol? If we did all this work to implement a strategy that does work, but it's not the strategy that fits us because we didn't look to see where alcohol is being brought in for young people, and we find out it's because they're having house parties because there wasn't the education around providing the dangers of providing alcohol to underage children, and we miss out that piece. But if instead we began by assessing the whole problem, knowing that that's where they're getting it from, that's what's happening, and then we can instead do training for parents, provide the connection with our different partners at the community level, with schools and law enforcement, healthcare, everybody coming in to identify that this is a need, educate, and then bring in the supportive resources. And we're going to be more likely to see the change happen for that underage drinking problem. So similar to the scenario I read you about malaria, it's not just picking one thing and going with it. It's understanding what is happening in your local setting, whether we're talking about it at that county level, a specific city, town, classroom setting. It's still the same pieces apply, where you have to consider what is happening, where is it happening, what are the different things that we're seeing, so that all of this is informing what we're going to do about it. The more we understand the context in which we're seeing substance use happen, the better we'll be prepared to identify what approach, what program that the research supports can help us address this issue. One of the questions that we throw out in the trainings that we do is looking at, excuse me, a sick frog. If we look at a sick frog and we say, well, what's going on here? Is it the frog the problem? Is it the pond the problem? So if the frog in a pond started behaving strangely, is it the first reaction that we do to punish the frog? Or is it to provide treatment? What is going on in this situation? And if, while this is a very unique kind of metaphor to describe here, when we see there's a sick animal, the first instinct is not to say, what did that animal do wrong? But it's more to say, well, what's going on in that setting? Are there any toxins in the water? Are people throwing trash in there? Is there a new species that has moved into that environment? There are all of these questions that we go back to ask to better understand what's happening. So it's not one thing or the other. You still have to go and treat the frog to bring it back to health, but you also have to go in and treat the pond to look at all different pieces that are having an influence on that behavior. It's not one thing or the other. It's all of them coming in together to really understand the context of what is influencing the problem. Now we take it back into our settings of substance use when we want to address an issue that we're seeing in our community setting, whether we're talking about fentanyl crisis, whether we're talking about underage drinking, whether we're talking about methamphetamine. We begin by asking what is going on in that context, not to blame the individual, but to understand what is happening so that we can better assist and move past the stigma of substance use, number one. But number two, identify what's going to be an appropriate fit for that community that you're working in. It's not looking at just one piece of it. It's looking at that whole picture to make sure all of these things fit together. If we only did one piece, taking you back to that scenario about malaria, if they only put mosquito nettings but didn't drain the swamps, or if they only put some mosquito nettings but they didn't educate the people, you were not going to see that the reduction in the cases that they were seeing with malaria. It is not one thing or the other. It's understanding what's going on in the context of your community to identify what are the things that you need to bring in. The prevention approach is multifaceted. There isn't just one thing that's going to fix or solve the issue that you're facing. It's usually multiple things. And the more you understand about what that looks like and what that is, the better equipped you'll be in identifying what's going to work best so that you can see that change in your community setting that you hope to see. So where do we begin? So that was just to set us up. Again, we haven't even gotten close to identifying what strategy are we going to do, what program are we going to implement, because without really understanding your problem, again, we as preventionists, we're scientists. We must identify what we do by looking at first what is happening. So we begin with those questions that we need to have answered. The what? What substance use or other behavioral health problems are we seeing? Who? Who is the population that is the focus of the intervention? Who are we trying to kind of focus and hone in on? When? Developmental stage of the focus population. This is so critical. And we say this because over time, children, youth, and into adulthood, you are at different developmental stages. And where you are in your understanding and also what you have access to is going to vary depending on where you are in that process. So if we're going to identify things like underage drinking, that could be anybody from a child, a youth, young adult before 21. But those different stages in life are very different. A curriculum we pick up off the shelf may not be the right fit because it may not be at the right level of understanding for the population we have a focus on. It may not be the right fit for where they are in the setting. What we talk about to someone who is 12 is going to be different than what we talk to somebody that's 18. They are in a different part of life. They are also in a different setting and they have access to different things. They have a lot of things that have to take into account. So that is a critical piece. And then the where, the context that influence the health. The why. This is so important for the work of prevention, is understanding the risk and protective factors that influence. We'll go into a little bit more detail here in a few more slides, but understanding these are the things that have an influence. They're not what causes it. They have that influence on what is going to happen. They increase the likelihood, or they're going to decrease the likelihood of those issues that we're seeing. And the how. How are we going to go through this process? Well, we're going to go through the process by applying the strategic prevention framework into this. This is that planning process that's supported by the research to show us the most likelihood to reach that positive outcome is by using this process and taking into account all of these different things that play a role. Again, taking us back to that example of malaria, there wasn't just one thing. Before even getting to the point of understanding, they had to assess their community. How would you even know one day if you're seeing all these deaths happening, where exactly is it happening from, unless you investigate and look into it? As scientists have to do that investigation, dig deeper into what we're seeing, making sure we know where the problem is happening, how is it happening, what are those risk and protective factors that are influencing what we're seeing. It's important that we move through this process in a very intentional approach and not just throw things together because we saw something on the news and say, oh, this is the issue that the community is facing. Is it? Is it an issue your community is facing? Is it an issue that's happening where you are, that you're focusing in on? We see that happen for many times as we see grants coming out focusing on a specific substance. And I say, this is grant, this money is for addressing opioids. And you go in, but if that is not the problem for your community, it's going to be very hard to see community change happen on that. You have to really understand what is going on to understand what you're going to do next. So then it means you have to begin by finding the focus. We need to find out what is happening in your community. We need to find out how is that happening. We need to know the nature and the extent of substance use problem and those related behaviors. We need to focus in on identifying what are those risk and protective factors that influence the problems and behaviors that you are seeing in your community. Again, there are lots of risk and protective factors, but you need to make sure you're identifying the ones that are related to your community, to the problem you've identified based on the data that you've been collecting. It's very important that you look to see what is contributing to the problem that you see. We can have something like the opioid crisis as a problem, but the nature and extent of that problem is going to vary depending on which community you are. In Florida, where back in 2017, Florida came out to say that there's an opioid epidemic in our state. Well, that opioid epidemic looked very different depending on where you were in Florida. How that evolved over time also has changed to see what's happened in small rural communities versus larger urban contexts. What's happened back when we began to see this in 2017 to what we're seeing now. You have to understand what is happening in your local area, in your local population, with the group that you're trying to focus in on. Otherwise, all the research in the world of these programs and practices and strategies are not going to be effective if it's not the right fit for the risk and protective factors you're facing, for the problem, the priority problem you've identified, if it's not the right fit. And then moving into looking at your existing resources and readiness of the community to address the problem. Just because your data has identified some issues of a particular problem doesn't mean you're at the readiness. So it's really important to examine both of those things, because without knowing where the community is on certain things or that readiness to be able to address it, it's going to be very hard to see that positive change take place in your community. So as you go through to identify what is the focus area, that is just the initial step that you're taking in. Again, we're not even ready to look at what is that strategy, what is that program, what is the approach we're going to take, because until we find out what the focus is, where it is, who is affected by it in our community, in the setting we're identifying, we have to look into those things first to really determine those next steps. So how do you know what the problem is? How do you know what to focus in on? Well, we have always community concerns. There's a lot of different things and topics that come up. You'll hear them in town halls, you hear them in meetings. That's one piece of information you need to collect. Then you've got the data that's been identified. You also need to take into account feasibility of addressing a problem. Just because it is a problem, just because it's in your community, doesn't mean it's something that you'll be able to address through some programs or practices or approaches identified. You have to take into consideration the resource availability. You can identify one of the best programs to implement, but if you don't have the ability to implement it as intended, then we may not come close to seeing those positive outcomes. And then also the capacity. Do you have the capacity to implement? And then, of course, the readiness of the community setting of wherever you're working in. Is that readiness there? Or are there going to be barriers to block the attempt to implement different strategies, efforts, or approaches? All of these things play a role into focusing in on what needs to happen, what is it that you're going to focus in on, and how are we going to move forward? So to make sure that we're moving forward in this process in the most systematic way, we are guided by what are known as logic models. I know many of you on here have heard logic models. I've seen logic models. It's one of the main tools that we have in our prevention work to make sure that we're guided with a good direction. We call these logic models our roadmaps. Roadmaps similar to like our phones. When we get into a car, we're going to go to a new place. We plug in the coordinates of where we want to go. And our phone and our map will help us to identify the best, the most efficient approach, the short, whether it's by distance, by saving on mileage, by avoiding tolls. It helps us to figure out where we're going to go and how are we going to get there. And that is exactly what this logic model helps us do. We know where we're going. This is the process in which we're going to identify what we're going to be focusing in on. Where do we begin? What are we going to address to get those positive outcomes? And you'll notice there are arrows that go in both directions. That's because sometimes as we move forward in the process, we do have to backtrack a little bit to gather more information or to get a little bit more set up in our capacity or our readiness as we move forward in this problem. So the logic model has three components. And usually when we do this presentation, we bring up one piece at a time, but we're going to do this static view here. So we begin first with identifying what are the problems and the related behaviors. So we're talking about the consequences and the consumption data points. So what we mean by this, consequences are those things that result because of. So the hospitalization data, the data that we get from medical examiner, the treatment data pieces. Those are all the data pieces that help us to identify what is happening as a result of substance use. Consumption patterns. So consumption is the use. So for example, for many of us, we rely on the Florida Youth Substance Abuse Survey, one of the longest standing surveys across the country, and especially here in our state. And thanks to the ongoing support from the Department of Children and Families to continue to implement that survey, we're able to gather information from youth from across our state at the state level, regional level, and county level to know what the self-report of use is at both middle and high school levels. We have past 30-day use, we have lifetime use, and we have a number of other types of questions that go into that. So that helps us to understand the consumption piece. And then to understand the consequences, there are some that we can questions in there that help us with that. But then there's also things we can look at, such as involvement with DJJ, school suspensions, hospitalization, all of those pieces. Those are all the things that you have to gather first to identify and know what is happening, what are those problems and those related behaviors that we're seeing in our community to move us to the next step. So what are the things that are influencing those problems and related behaviors? That's what we call those risk and protective factors. The risk and protective factors are those intervening variables. They're not causing, we can call these causal factors, but they're not actually causing per se. They just have a relationship that influences, that increases the chance of these problems from occurring. So if we identify what it is that is influencing the problems, now we have an understanding of what the problem is, what is influencing it, and then helps us to move into that category that I know many of you want to know is, okay, so tell me, Kathleen, how are we going to know what to do? Well, first, we know what is our problem, what's influencing our problem, then what intervention is out there that can address what's influencing the problem, that will then go back to address the problem itself. So this relationship that you see here, moving from one side to the other, all of these things have to be built off of each other. You begin with understanding your problem, your consequences, and your consumption patterns, to understanding what are those risk and protective factors that are having an influence on those consequences and consumption patterns, to identify what are interventions, what strategies, what approaches are we going to take that will go back to address those risk factors, that will go back to influence the problems. All of this is the approach of how we guide what we're doing. And the reason we also have these logic models, these roadmaps, is by having in our focus of where we're going and how we're getting there, helps us to make sure we're staying on track. Because if we have a map on our phone, we're driving somewhere, if we're not looking as to where we're supposed to turn or listening to turn right here, turn left here, we'll just be going off straight and we'll completely miss where we were supposed to go. Having this logic model in the forefront helps us to ensure what we're doing, what's been identified, is the way in which we're continuing to do that. But key to this, again, is looking at the data that we have available, the research that supports addressing the data that we've collected, because at the end of the day, we as preventionists are scientists. We're not just picking something because it sounds good. We're identifying different strategies, programs, and efforts based on the data we've collected, based on the risk and protective factors that we've identified, using the research-informed and evidence-based programs, curriculums, strategies, efforts to address all this data that we've identified. So everything fits together. Everything is moving strategically. It's not a guesswork. It's all very intentional. We're making sure everything relates together, and all of these pieces fit in and are tied together so that we have the best and highest chance of reaching that best possible outcome. We don't have enough time to do guesswork and hope that something will change. We need to have that assurances, and the assurances are given to us by what does the research show us, what does our data tell us. All of this fits in together. I'm looking into the chat, but I don't see any questions. But if you do have more questions as we go through this, please feel free to type them into the chat so that we can make sure that we're addressing them as they come up. So taking us to understanding the nature of the problem, of what we're seeing happening, it's very important that we look and see what are those problems and related behaviors. Which populations are experiencing the most? How often are they occurring? Where are they occurring? Again, we'll take the example of underage drinking. We can look at our data and say underage drinking is an issue. Where is this an issue? Are we talking about middle school students? Are we talking about high school students? Are we talking about college students? Are we talking about young adults from 18 to 20? Without understanding really the group that you're trying to focus in on, it's going to be very difficult to identify the best and most appropriate effort, strategy, program, curriculum that is needed. This helps us to, asking these questions helps us to get to better understanding the context of what is happening to whom and where and how. If we know these things, we'll be in a better position to identify what is going to be the best course of action for us. Same thing for when we plug into our map. If we don't tell the map exactly where we're trying to go, what we're trying to get at, it's going to be very hard to give us the best directions to get there. So again, I'm going to put this back up here. If we don't know exactly what we're trying to get to, these things won't fit together and we're not going to see those positive outcomes. Just like the roadmap on our phones as we're trying to drive somewhere, if we don't place exactly what we're trying to get as that end outcome, we may not get the right directions to get to where we're going, and we will never see the reduction that we're trying to see in these problems and related behaviors. So I can't stress to you enough how critical looking at this information and looking at the data is to identifying what you're going to be doing about it next. So that leads us to the question about the data. So I know many collect data and they'll say, yes, I've collected some data for understanding my community. What data do you collect? What is it that we're being able to review and assess to inform our understanding about what's happening? Is it giving us the full picture? Are you collecting both types of data? Is it both quantitative? Is it and qualitative? Is it one or the other? And the reason I've got both of these circled is because you cannot have just one piece of data, one data source, one perspective of your community that you're looking at, or you are going to miss the full picture about what's happening. If you miss the full picture about what's happening, you're going to risk the danger of selecting a strategy, program, or effort that is not going to address the issue that you're trying to address in your community. Quantitative data shows us how often an event or behavior occurs and to what degree. Those are the hard numbers that we look at. Those are the things that we see out of the Florida Youth Survey. It's the what we see when we collect information from the medical examiner report. It's the hospitalization visits. Those are the numbers that we can count to show us that there is an issue. Qualitative data, on the other hand, helps us to better understand the context as to explaining why people are behaving or feeling a certain way. Why is this happening? It helps us to get to some of those additional follow-up questions. If our quantitative data is telling us underage drinking is an issue, we know this because kids are reporting past 30-day use, and we know that this is happening on a regular. But if we don't understand, well, why are they increasing their past 30-day use? Where are they getting the alcohol from? Who are they hanging? Where is this happening? How is this happening? It's going to be very hard to select the right approach to address it because there's a lot of different things that could be influencing. Without understanding those pieces, we run the risk of missing out on the best and most appropriate strategy, program, curriculum to address what's happening in the community. If we take another example, opioid crisis. For Florida, in 2017, we said that we have an opioid epidemic. What that means across our state looked very different. We have the quantitative side that showed us the numbers, the deaths, the hospitalizations, arrests, all of these different things. But it's that qualitative piece that helped us to understand, well, what did that look like in different settings? What were we seeing? Was it an issue of medication? Was it an issue of heroin? Was it an issue of other types of things out there? And understanding those things helped us to better prepare our communities in targeting the types of strategies, education, programs, curriculums, and treatments. Knowing those differences helps us to be better equipped to figuring out what's going to fit best, what's going to work with the work that we have. And one of the reasons we also continue to push the importance of multiple data sources is all data sources have issues. There is not one data source out there that is free of issue. There's not one data source out there that doesn't have some sort of problem, downside, negative to it. However, if we have multiple data sources that we're looking at, and when all of those data sources are telling us the same picture, we are much more confident in knowing that what we are identifying is really what the needs are for that community that we're working in, for that population we're trying to focus in on, for the situation that we're trying to address. Without really understanding that, you are going to risk addressing an issue that may not actually be the issue. but having multiple data sources is what will help us to better figure it out. There are different kinds of data out there. There's different relationships with them. There's also different issues that some of them present than others. There's differences between self-report data versus data that you find that's things like arrest data, hospitalization data, or those types of things, which there's also differences from what people tell you, wherein there's differences all the way across. But each one of those things brings a piece of that puzzle. Looking at it all together gives us a real sense about what we're trying to address. If we have a sense of what we're trying to address, we have a better chance of selecting the right, best program, curriculum, strategy, approach to meet the needs that we've identified in the data. So again, and I'm going to keep saying this, we as preventionists are scientists. That is a key to the success of what we do, because that allows us to make sure we are intentional with the work that we do, that we're relying on the evidence, the research that's out there. We're making decisions based on what we have available presented to us. So we need to be that scientist in our everyday work of prevention. We need to compare different data sets, populations, geographic areas. We need to question the data. We get data from all different sources. And I've been working with data for a long time in a lot of different capacities. And I can tell you there have been data sources that I've been surprised at some of the downfalls or negatives that come out after looking through the information. Not all data is created equal, unfortunately. Not all data is collected the same. Not all data gives us the full picture or understanding. Not all data captures all of our different subgroups. So when we look at data, question data, not because you don't appreciate the data, but question the data because there gives us the chance to figure out what else should we be looking at? What else do we need to take into account? What else do we want to incorporate into understanding our population? The better we understand what's happening, the better we understand our population, the better we have a chance of seeing success take place, because we're going to pick the right strategy, program, effort, and approach to fit that need. It's really important too to look at subgroups. If you're looking at a particular part of your community, but you're continuing to rely on county level data, you might not be able to really understand what's happening for that particular population. So while there are data sources that give us county level, it's really critical that you also look to see, well, what can we do to get more of that subgroup population level information so that we know that we're understanding that. I work a lot in the Jacksonville community, and we have been working with a project with the Department of Children and Family was able to fund through our Drug Epidemiology Network efforts. And it was to address opioid crisis back in 2017. And while Jacksonville is the area we're focused in on, and we've got county level data, what that county, which is the city, looks like looks very different across one part to another. So if we just remained looking at the information at that county context, we would completely miss out on the differences and issues that were being faced across the community. So moving it down to things like zip code level allowed us to see the differences across the community's settings, allows us to see the differences in the types of substances that we may be seeing or resources, all of that helped us to really see what was going on at that more local level. And it's also really important that you look at data not just in an isolated 1 year stance. There are things that can change over time. There are things that sometimes there's hiccups in the way that data is collected, or there's differences in the way data is collected from 1 year to the other. So looking at data over time helps us to answer a lot of different questions. It helps us to look for any anomalies that take place. It helps us to understand if there's any issues that before were not there, but now are, which is why our data is looking different. It also helps us to see maybe even some changes in not necessarily predicting what will happen in the future, but if we're seeing a steady increase over time, that helps us to understand, unless we start to do some interventions along the way, that trend line is going to continue up. So looking at ways that we can address that will be very beneficial. And it's not looking at data just necessarily over time. Sometimes it's looking at data within the same time frame. Many of our communities have different things that happen throughout the year that sometimes drive some of the substance use trends. We've got things like spring break. We've got different events and festivals. All of those have an influence sometimes on what we're seeing in the trends. If we don't take those into account, we might miss the mark of some possible recommendations for program strategies and efforts to be implemented in the community setting. So be the scientist, question the data, look at multiple data sources. Make sure that you're asking those hard questions, not to say that you don't appreciate a data set, but it helps us to better understand a data set. It also will help us in the long term to maybe even inform how some of the data is being collected. Without looking at the data on a regular basis, you might miss something. I've been a part of a couple of different work groups where we look at data. And because of some of those work group meetings and looking at the data, one of the times we found out that there is a data source that was being collected, but there was a hiccup in the data reporting system that wasn't bringing out the data correctly to the right reporting agency. So if we hadn't been looking at the data, we wouldn't have seen that little hiccup. And so if we didn't see that hiccup, we would have been thinking that the data that was being reported was the actual data. And some of that community would have missed out on some of the needed services because that data reported was not accurate. So looking at data helps us in so many different ways, but it most absolutely will help you as you identify what's going to be the most appropriate approach and strategy for your particular population of interest. And I love this image. It's one of my favorite depictions on that SAMHSA has put out to explain epidemiology, because this shows us all of those different pieces that kind of work together to understand what how everything fits together. It helps us to understand why it's so important to take into account those risk factors, those protective factors. It helps us to understand how you have to look at the person, place, and time. All of these pieces are helping us to better understand what's going on within our community. That epidemiology is concerned with that distribution and determinants of health in populations. It helps us to really uncover who is affected, where are they affected, when. Similar to what the little scenario for malaria. If understanding the who, what, when, where helped to come up with the recommendations on how to address it, showed that reduction in malaria cases, and that meant the reduction in death. That shows how looking at all those little pieces fit together to inform decisions, to inform approaches, to see the change happen. We must apply that same approach to all the work that we do across behavioral health and really across any issue that our communities are facing, whether it be substance use, whether it be violence, whether it be any of these different community concerns that are affecting the groups that we work with. So if we understand all of these pieces, we're better equipped to understand what is going to be the best approach for what we're facing. If we are better equipped to understanding that approach, we're better equipped to identifying the most appropriate strategy, program, effort for what we're trying to change. So then let's talk a little bit more about those risk and protective factors. Risk and protective factors, again, they're not the causal thing, they're not causing, but they have a relationship with the problems and related behaviors that you're trying to address. This roadmap that you see here before you helps us to make sure what we're going to be focusing in on is really what is driving those problems and behaviors, so that the interventions identified will really help us to address the things that are driving the issues. And once we identify what those priorities are, we help to assess those risk and protective factors that are influencing. And these are the vital pieces, because you can't change the problem itself without first addressing these risk and protective factors. So you have to work through understanding those underlying issues to address the problems and related behaviors. So while it seems like my main goal is to reduce underage drinking, yes, it is. But first, before you can reduce that, you have to reduce what are the things that are driving that. My issue is I want to reduce the use of fentanyl. Okay, if you that's what you're going to be doing, you still first have to go with, well, what is driving that? By understanding what is driving the issues that you're focusing in on, you can figure out what can you do about it. So the what you can do about it is what we're going to be getting into. But first, understanding the right risk factors for the problems you have in your community is going to be very important. And understanding them and how they fit in all these different contexts is going to be really important as well. Now, there are a number of risk and protective factors that apply to multiple problems. And that's okay, because it's as long as we still find the connection of what you're focusing in on, those risk and protective factors to that particular problem. That's where you have to begin before you move into identifying what population, what intervention you want to address your population. So the risk factor, a risk factor is a characteristic at the biological, psychological, family, community, or cultural level that precedes and is associated with a higher likelihood of problem outcomes. Again, it's really important to emphasize this influences the likelihood. It's not the cause, but it's the likelihood. And by addressing those risk factors is how we are going to be able to move forward to see the changes in the behaviors and that we've identified. Here are a couple of examples of the evidence-based risk and protective factors. So I'm going to bring it back to that discussion about evidence-based. The evidence-based, it means that there has been research studies that have been conducted. There are researchers, there are other scientists out there that are examining how these things have an influence on the problems that we've identified with our data. Just because you use it and call it a risk factor does not mean it's an evidence-based risk factor. There are a number of different resources out there that SAMHSA has put out to show the different risk factors that have been identified by the scientists in our field, by the researchers, that these are the things that really are influencing those problem behaviors. So, for example, for underage drinking, these include things like low perception of harm from alcohol use, social norms that accept underage drinking, easy retail access, low enforcement of laws, easy social access, low or insufficient parental monitoring. And again, I stress that we look at things that are evidence-based risk factors, not just something that we pick up saying, oh, well, logically, this would be a risk factor. This must be what's influencing that behavior. Always stop to question that. Always make sure that if you are going to address a risk factor, do the research to look to see if this really is an evidence-based risk factor that has been identified in the research, in the literature, to say this is what is influencing. I'm going to put into the chat a link that I think will be very beneficial for you all from SAMHSA that helps to get more information. There's a whole section in there on risk and protective factors. We could do a whole training on risk and protective factors alone, but we still have a few more slides to get to. But I really want to emphasize the importance of relying not just on what you think a risk factor is, just because it's thrown out there and it sounds so common sense. A risk factor still, like the different strategies, programs, and curriculums, we want to make sure that what we identify as a risk factor is something the research, those scientists in the field have identified through the work that they've done, that these really are what are influencing the behaviors that we're trying to fix. Because if it's not, then how are we going to ever even address the different problems? So I put that into the chat and recommend that you definitely take a look at that for more information. And I will put one more link from SAMHSA to one of their reports that I find very useful. We're going to talk a little bit more about those different programs and practices here in a few, but the more resources that you have available to you, I would go to these, especially from SAMHSA, and save them, bookmark them into your web browser so that you can always go back and look at them. We want to always remember that we as preventionists, we're relying on the evidence, on the research to do. We look at things like these risk factors that the evidence and the research shows us to have that influence on those behaviors we're trying to change. If we don't make those connections, it's going to be very hard to be able to do that. So while we do seem to focus a lot on those risk factors, that does not mean there isn't a positive side. So we do also have things known as protective factors. And those are the characteristics at the individual, family, or community level that is associated with a lower likelihood of problem outcomes. So these, again, are the things that the researchers have found to be evidence-based protective factors that have an influence to decrease the likelihoods of those problem behaviors from occurring. So these are the examples of the evidence-based protective factors. Low sensation-seeking personality characteristics, fewer positive expectations of alcohol, pro-social activities, including volunteering, fewer friends who use substances, parental disapproval of substance abuse and other unacceptable behaviors, positive opportunities to belong, personal importance of religion. So again, these are not just protective factors because we think these are good things and they make us feel good. These are because the research has found them to be what has influenced the behaviors to reduce the likelihood of those negative behaviors that we're trying to address. And so if we are able to look through this and make sure that the next step of identifying the right approach, curriculum, strategy, effort ties back into these protective factors or the risk factors that the research supports and shows, we're making all of those decisions in our logic model, in that roadmap, based on the evidence that's available, based on the research, because at the end of the day, we as preventionists are scientists, and we're doing these in a very systematic and strategic approach so that we have the best likelihood to see the positive outcomes that we're trying to get at. And those positive outcomes is reducing those problem behaviors that we've identified. That is the key. But to do that, we have to address those risk and protective factors. So that leads us to the next piece. While there are research evidence-based risk and protective factors that have been identified in the literature, they have done literature reviews, they've done research studies, they've done all of this work behind the scenes to gather up all this information to equip us in this field to make the best decisions we can to address those problems we've identified based on the data. Just because those exist, we need to take it a step further to make sure that what we're identifying really fits into the work that we do. We have to consider two particular things: the importance and changeability. The importance is how much is the risk and protective factor identified influencing that problem. And when I say importance, I don't mean, the community thinks it's very important to them, or this group I'm working with thinks it's very important. That's not the type of importance we're talking about. The importance we're talking about is it can be a risk factor and it can be research supported, but is it the risk factor that is influencing the problem that has been identified in your community setting? So just as we've collected all of the data to understand our problem-related behaviors, we also have to collect the data that relates to those risk and protective factors. So for example, in our Florida Youth Substance Abuse Survey, there are a number of questions that we can look at to look at those risk factors, to look at the protective factors. But then it's understanding, are the ones that we're seeing the ones that are most influencing the problem? Does it influence other behavioral health issues? It's always good to look at the ones that are affecting multiple problems, because then we're making an even better approach by addressing multiple issues. And does it directly impact the developmental stage of the population? So we can identify a problem such as underage drinking, and then we look at some of the risk and protective factors that we've identified based on the research. And we say, okay, well, then we're going to do on the easy retail access. Okay, our research says easy retail access is a risk factor for the problem that we see of underage drinking. Well, but does that really fit what we're seeing in our data collection? So understanding the population that we want to focus in on, is that what we're seeing? Are we talking about kids that are in middle school? Are we talking about kids that are off in college? Understanding those pieces are really important as we're looking at those risk and protective factors. Just as we have that list of risk and protective factors, you'll find on SAMHSA's website, you can also look at what are the different risk factors that have an influence based on the developmental stage, whether they're young child, youth, a young adult. And then this goes for all of the other substances. I'm just throwing some out there that most of our communities do work with and face. And underage drinking is definitely one that pretty much every single community has some sort of work around this. So I throw that out so that everyone on our call here can kind of connect with. So in addition to the importance comes the other piece of changeability. Is there adequate capacity to change the risk and protective factor? Does a suitable evidence-based intervention even exist that address that particular risk protective factor? And can change occur in a reasonable amount of time? There are a number of risk factors that are very, very challenging or difficult to change. So that might not be the best one to focus in on, even though it may have a major influence on your problem. And it may be, something that we're seeing that's influencing the problem identified. But if it's something that is not easily changeable, it's something that you can't address in the time set frame that you have because your grant is only for 18 months and it's going to take more than that to address this risk factor, that may not be the right risk factor to focus in on. So again, this is why those steps are so critical in that roadmap that we're talking about. Those things have to be ironed out and figured out first before moving into what is the right strategy, program, approach, curriculum to implement. Because these are the things that are going to influence figuring out what's going to work best. So the more importance and the more changeability that you see with the risk and protective factors you're focusing in on, the better chance you have to be able to see that effective change. So these are the critical pieces that, again, before even selecting what you're going to do, you have to take all these things into account because it sets you up for the opportunity for success to happen. If you don't take these things into account, it makes it very difficult and challenging. And we run the risk of people saying, well, see, prevention doesn't work. Prevention does work. It's a science. There's evidence and support to show a lot of different things, create those positive outcomes in the substance use trends that we see. However, if we are not intentional in moving through this process, I know it seems like I'm saying a couple of things over and over, and part of it is I'm saying it so that it really resonates for you, how important, how critical all of this data collection process is in identifying the right fit and connection so that everything that you do is going to set you up for that success to take place. Making sure that you're looking into what is happening here, how much of this, the focus of those risk factors is influencing the problem you've identified, how much of it is actually changeable within the time frame you have, within the funding and capacity that you have, is really critical for this. And this also helps to bring in the partnership support so that when you go back to your funders, you go back to your community, you have the support behind you to show this is why we're doing it this way. Is the things that we're doing really going to see the positive outcomes? And why do we not pick this program over another program? Well, because we are taking into account developmental stage. We're taking into account the availability, changeability, and readiness, because we're taking into account all of these different things that are playing a role in substance use. And again, this is that lovely roadmap. This helps us to make sure that where we're going to get there because we're very intentional in collecting our information and our data. The problem we've identified is what is related to our particular population, our particular community. The risk and protective factors are the data we've collected that shows this is what's influencing those problems in my community setting for my particular population, for where we're going to be focusing in on to identify the intervention. And then key to this is making sure that you're taking also into account the readiness, and the resources that you have available. Without knowing those things, you can pick something off of a shelf of a program or a best practice site, a toolkit. But if that resource and readiness, if you're not there, it's going to be very hard to implement and get you to that success. So assessing your capacity is looking at what resources you have. What resources do you still need? What is it that is available in order for you to be able to move forward? Particularly looking at the needs of your priority population. You'll have to understand what is there, what is still needed, what is still feasible. And that readiness it has to fit the readiness of the community, the population you're working with. Are we in a place where it's going to be feasible to implement? Are we infusing, is there a cultural competence being infused along the way? Are we looking to ensure that we're providing a safe and supportive environment? Do we have the right protocols in place? Do we have the tools and the technology to be able to implement what we need to? Do we have the ability to mobilize to be able to achieve what we need to achieve? All of these different things have to play a role, and it's looking at those resources, looking at that readiness together, which is what helps us to assess our capacity to move forward. And without knowing this, it's going to be very hard to take the next step of picking what's going to work best. So in building up that capacity, it's increasing those resources and it's improving the readiness. And that you do that by engaging your stakeholders. You do that by strengthening the collaborative groups and partnerships. You do that by raising awareness. You might have readiness, but the lack of understanding and awareness of a problem will kind of fall short on that readiness. So it's sometimes taking it a step back to make sure your community understands, the groups that you're working with understand. You have your partners at the table to look and see how we can leverage different work. There's a lot of funding that is out there, the grants coming out, but there's also a lot of restrictions. So just because you receive funding to implement something doesn't mean you don't need your partners also at the table to fill in the gaps, because there's always going to be gaps, because there's always restrictions when it comes to funding. So making sure all of that is taken into account is going to be really critical. So what does it take? Think back to when you were part of a group or a task to set up an event. Why was it successful? And I would love for you all that we're sitting here, and you've heard it from me quite a bit. I would love to hear some thoughts in the chat about what has been something that has helped you to get success. What has helped you to get to that readiness in your community setting? Whether it's you're talking about a countywide coalition, a provider working in a school system, a partnership with an after-school group. What are things that made what you did successful? And Rebecca, are they able to connect on the chat to send their thoughts on this?
Yes, I see a few coming in, but they're sending them directly to me. If y'all wouldn't mind, please send them to all panelists instead of just to the host. That way, Kathleen can see everything, and so can Laura.
Perfect. Thank you. I see we've got some coming in now. So keeping all parties informed of each step in the process, pulling in an event, absolutely. The positive engagement, yes. Working with local coalitions and organizations, absolutely. Multi-provider approach with good communication. Oh, I love that. Yes, definitely. Having working relationships with community partners to help with client engagement, absolutely. Oh, I like this. Clear roles and responsibilities. Very good. And open to all ideas, brainstorming, collaboration, trying to change the culture. Yes. So it's all of those different pieces. They all play a key role into creating a place where you are at the readiness. So that builds up that capacity so that you can move it to the next step. Now, I would like you to kind of think about this in a different way. So think back to a time where you're working on something, you're trying to set up an event or a program, but it didn't work out. Why did it not work out? Sometimes it's beyond our control. Sometimes it's something that happens in our community that you had nothing to do with. But knowing what are those things is important for us to share on opportunities like this. So the same thing as the first question, think back to something that did not quite work out when you tried to implement an event, a program, a campaign, or approach. Why did it not work out? So again, if you would just put to all panelists, that way we can see. Okay, we've got some good ones. Lack of communication, absolutely. Lack of support, mindedness, poor communication, advertising, not confirming, lack of resources, lack of teamwork. Exactly. Very good. All right. Not reaching out to the correct agencies, not getting permits, parking. Yes, all those details. Unclear points of contact, lack of support. So we're seeing a lot of similar themes coming in here. So the communication not there, lack of support, poor collaboration, all of those things that now we're talking about picking a strategy, curriculum program to implement. And the best research supported program curriculum strategy to address what our data shows, while it seems like those two things should be working with zero problems, it's examples like what we're seeing here that could take the best supported research approach to what the data shows us as our needs are, to what those research supported risk and protective factors are, can also fall apart if we don't have that communication, clear points of contact, the pieces of collaboration, the follow-up, the teamwork. Without those things, all of the research that shows we should be having the most likely to succeed can fall apart. So when picking what you're going to do, it's really important all of these things are taken into account and also put in as a part of this process. So thank you all for chiming in and putting that in there. The more we know about this, if we know those things at the beginning, we know the barriers that can really make these things unravel, then we can work extra hard as we're building up that readiness, as we're looking at the resources, and making sure we're addressing the capacity that we're doing things from the beginning to reach that success. Oh, this is also a very good one. So thank you for this. The high turnover rates impacting delivery of services. So again, that speaks to the readiness. You may have, the problem identified from your data. You may have a great opportunity for implementing an evidence-based program or approach, but if the turnover is something that you're dealing with, it can definitely unravel if you don't take those into account and put those safety pieces into effect. Thank you very much. And then that comes to building up our capacity by raising awareness. Sometimes we don't have the partnerships at the table because some of the community partners don't realize that they're needed. Sometimes the community doesn't realize that a problem exists. It's amazing to me that we continue to talk about things like fentanyl, and I still have people saying, well, what is that? We talk about Narcan, and I went into to drop off my kids at the school, and I was just curious. I said, oh, do you guys have Narcan here on campus? Because I'm hearing about a lot of school trainings and access to resources. And the person at the front said, what's a Narcan? So it's interesting that while we're in the know of all of this, outside in our community setting is not necessarily the case. This picture that you see here is from when we did Prevention Advocacy Day. I think it was last year. We are excited to say that we again went this year to do prevention advocacy with all of our prevention coalitions and partners in collaboration with Drug Free America Foundation to bring attention to a lot of different topics related to prevention to our policymakers. One of the things that we talked about was what we're seeing across gas stations with Delta 8. And I can tell you that I went to one of the appointments to speak with the legislator to share about what we're seeing. And she was very surprised because she had not heard of how much this was happening in the community and what was available and what was out there. And she was kind of empowered because of our conversation to say, we need to create change. Send me more information, connect me to the local coalitions and providers in the community that I represent. And so that's what we're going to be doing. But it's raising that awareness is what helps to create that readiness. Now, by having more policymakers to understand, it helps us to get them to be a champion with our work to help to bring this awareness to create the change. So awareness is so critical and helps to address the things that you all listed here for the lack of cooperation, the communication. Awareness does so much. And unless we're continuing to increase that, it makes it very hard to sometimes address an issue. We're in the know of what's going on because we look at the data, we look at the research, we talk with one another, but the everyday person in the community may not know about this. So unless we are raising the awareness, it's going to be very hard to increase the readiness. So very critical to this work and a key piece into making sure what we do identify for the right program, the right curriculum, the right strategy, the right approach is going to be successful. So asking you all again, how do you raise awareness where you are? On our webinar here, we have people from all different parts of our state working in coalitions and providers, community partners. How do you raise awareness in the work that you do? I know some of you go to Prevention Advocacy Day because we saw many of you coming out. We had over 150 people coming from all across our state, which was exciting. Okay, we see some here, community outreach. Excellent. How else? Oh, fantastic. Belonging to coalitions, lunch and learns, going to community meetings. Very good. Social media sites. Absolutely. Social media and the access to technology is something that really boomed after 2020 because we all needed some way to reach our community. So definitely a great way to get that out there. Schools, education during agency monthly staffings. Excellent. Educating children and families, absolutely. Outreach directly to pharmacies, law enforcement, and schools, absolutely. That is fantastic because the more we engage with those community partners, they may not know that they can play a role in this work that we do, and it's fantastic. Lots of stakeholders, churches, excellent. Yes, just by having the conversation. That's something else that I took away from our trip from Advocacy Day this year is it just happened to be a day that there were several schools of pharmacies from University of Florida, FAMU, and a couple of others that had tables set out. And so, of course, I went and introduced myself and talked about the importance of safe storage disposal and resources that we have access to, like the Terra. And immediately they said, that's fantastic. We're about to go into a whole discussion and training about medication disposal. So now, because increase the awareness that we have resources like that and what coalitions do across our state, now we're going to be able to connect with yet another partner. That continual conversation and increasing that awareness is so critical. We've got here some more marketing program availability. Excellent. Yes, community health fairs, national night out. Lots of opportunities where people can see what we're talking about, can see the importance of this and have them visible in your community, whether it's in the virtual setting or in person. That visibility goes a long way. The more we talk, the more we educate, the more we provide access to resources like things like the Terra, like Narcan, like many other things, we're able to raise that awareness and also empower our communities and our families and individuals to take a part and a role in the work that is being done. Thank you very much. Excellent. So again, it's pulling in the resources that you need, making sure the readiness is there, all the things that you all mentioned here of the importance of communication, collaboration, raising the awareness, all of that fused in with cultural competence is what will help us to get that capacity to address the problem that we have. And Laura from my team, she's our director for training and education, does a lot of training with us on cultural competence. And Laura, if you wouldn't mind saying a few words here about cultural competence, especially this graphic and image, because it's so important, this work. And it could be we're having a little bit of audio issues. So I'll continue on until she can join us on here. So cultural competence is something that you as a prevention scientist will always need to have training in, ongoing education, because there is never an end. I can, absolutely. Thank you.
Terrific. I apologize about that, but I am here now. Cultural competence, cultural consideration, it's a huge piece of it's a critical piece of the process of choosing the best and the most appropriate intervention. Without that piece, we may have gone through all of the other work that Kathleen already laid out, considered all of those things, really feel like we're on track. Then we get into the thick of it and we wonder why it's not being received the way that we thought it would, or it's not as effective as we know that it can be, and we're left a little bit behind. So if we make sure to include culture and cultural awareness, cultural competence into that process, we can avoid kind of up against that brick wall. Within culture, we are really talking about we're looking at the actual culture of the population or subgroup that we're trying to serve, sort of in or our community at large in a sociological sort of general context, right? But then we're also looking at our own level of cultural competence as both an individual and as an organization, right? And speaking to what's on the slide, what I mean by culture is all of it, everything that goes into making an individual. So while yes, there are cultural things that are shared, there are also things individual to those people within having some sort of awareness or working knowledge, and doing a little bit of work paying attention really go a long way, because as we see on the slide, 10% of culture, only 10% of it is stuff that we can observe without engaging or asking or learning or really getting into the thick conversation. Those are things like we can make some assumptions, and honestly, sometimes those assumptions are wrong based on what we see the way someone presents, right? So the art, the way they dress, sometimes see them practicing customs or the way that they're behaving and observe certain things. And there are things that we can compare from that. But really, all of the other things, the 90% of the rest is part of the iceberg that is below the waterline, or in this case, what it symbolizes is below our level of awareness, right? Those are the values, the beliefs, the norms, the way that we're seeing the world that makes us into. Those things are so important, right? So it begs the question, why is that important in this context, what we're talking? Some of you mentioned things in the chat before when we were talking about what made previous events or strategies that you did successful. We talked about culture change, talked about things that made it unsuccessful. The word mindset came up, there was a closed mindset, right? So when we are looking in the planning process, if we can identify those things we might run into, we can prevent ourselves from being there after saying, wow, that didn't work. So when we discover those things, and one of the really good examples I know that we run into is when we're talking about harm reduction, right? So not everybody's in the same place. Their understanding of that issue or all of the different layers to that issue, they may be sort of culturally as a community, okay, with one piece of harm reduction, but another piece just a little scary or a little too far, or they may have information about it. And so those things are important to know and look at through that assessment process when we're looking at resource. We're looking at readiness. You really can't look at readiness without looking at culture. So we're looking at that piece. We're also wanting to look at things like, are we providing a safe and supportive environment for all participants? Do we have cultural representation? By cultural representation, I'm talking about language, gender, age, all of them, right? So we want to make sure we're taking a look at all of that. One of the phrases we like to use is nothing about us without us, right? So in its simplest form, if you're serving youth, you're going to want youth on that committee. If you're serving moms, you're going to want moms to have a voice in that process. And some cultural groups are going to be more difficult than others, but still a worthwhile endeavor. One of the examples I always think was so beautiful, community that had a very large population of migrant workers, and they wanted to put programs in place. By the very nature, again, that first more general subgroup, generally speaking, they're going to be more transient, right? Might not be really open to connecting with the greater community. And also the work versus the education is typically a priority. Makes it a very difficult population to reach. Instead of going on without that particular community, found that that subgroup was attending church, and that those church leaders were not transient and were open to those conversations and were able to serve as a leader. And so that became a very effective relationship where we were able to get representation of that community. And then the last thing that I want to kind of put on your mind in terms of cultural competence is to make sure that we're developing the protocols, the tools, the technology, that all of those things are culturally competent. Do you have things that are accessible to the deaf and hard of hearing? Do you have things that are, visual versus just a lot of words? Do you linguistically, if you have a population that does not speak English, or is your stuff translated? Like, that's kind of the baseline stuff we want to make sure we have in place for accessibility. I could go on and on about this, but I will not in the interest of time. So I'm going to pop it back over to Kathleen. But Kathleen, I appreciate having a couple of minutes to speak.
Thank you so much, Laura. And like I said, cultural competence and training around this is so important for our field. And it's one of those things that will never end. There is always a need to further educate, prepare, and bring attention to this. Because when we talk about culture, it's not just one piece. Culture talks about geographic unit, background, ethnicity, subgroup population, so many different things. And I know we're running a little bit shorter on time, but I had this question about what steps do you take to ensure you're culturally competent? And we have a response already from somebody that when I read from Renee Teester from Citrus County, who said, having cultural competence training helped me this week. One of the young ladies I brought to Tallahassee for Prevention Advocacy Day was from the Seminole tribe, and having training in this area helped me to understand the challenges that she has gone through living on a reservation and encountering substance use. Thank you so much for sharing that, Renee. And that's one of the things that we can do to ensure our cultural competence is making sure we have training available for ourselves, for our staff, for the different groups that we work with. Because while we do a lot of work and can train our own staff, it's also important to bring this to the different partners that you work with so that we don't have any unintentional consequences as a lack of some cultural competence. So we want to make sure as we work with different groups and we build up the collaboration and communication that many of you shared as key to reaching that the success is that you bring this piece into it as well. So we're all starting off on the same page and increasing that awareness over time. Someone else had mentioned, changing that cultural context with the different partners was a key to the success. So you do this through these pieces and then also making sure that you're practicing this. So all of these things we're going to lead us to that piece that I know you thought we were going to do the whole discussion about this, picking the right strategy and intervention and approach and curriculum or program. So in order to even get to this place, all these things that we just covered here today are so important, making sure that we're relying on this logic model to guide our work based on the data that we have that looks at the problems that we have in those related behaviors and the data that we have that identifies the risk and protective factors that are influencing the problems we've identified, making sure our resources and readiness are there to get us to that next step of figuring out what are we going to do, what is going to happen next. And in that selection process, here are the questions that you'll want to have answered. What assets already exist that can be built upon? You're talking about collaboration with your partners and your groups, looking at what do you already have in place? what are those gaps and what are the challenges to implementing a recommended strategy, curriculum, or program. Based on existing assets and gaps, what strategies can be implemented with success? There may be things that you want to do, but which ones can you do? Evidence-informed strategies are most effective when implemented with fidelity, and evidence-based programs, same thing. Fidelity means you're going to implement as intended. We know that there are times that you have to make some additions or bring some things in to add to, but never to take away from the intent and focus. If you start to take apart and take away from a program, approach, a strategy, then you are losing what the evidence is. The evidence is what was seen based on research studies done, the empirical tests, the randomized trials, quasi-experimental research studies. They all did all that work and groundwork to identify what's going to be most effective to reach success. If you start picking apart the things that they identify as effective, then we're no longer taking our approach as a scientist to implement things the way they were intended to reach the success. So then we shouldn't be surprised if our success isn't achieved. We have to make sure, as the scientists in our prevention field, we're taking all of this into account. And there are many examples, and I'm going to put into the chat here where I put it before, but I'm going to bring it back up just to bring this attention here. Go to this site from SAMHSA. They have various resources listed on here. You've got the blueprints that are on there that you can have access to the information from registries of what is available for violence prevention, substance use prevention. They have a strict standard for evaluating program effectiveness that is all available there. So you are able to search through all different kinds of programs and strategies that you can look at that address not just substance use prevention, but also delinquency and violence and a few others. There's also a great information that comes from the evidence-based practice work group that is in there. SAMHSA has recently also published their Suicide Prevention Research Center that has the best practice registry. There's a lot of other tools that are listed on this, and I highly recommend you please take some time to look into this. And remember, not all interventions are created equal, just like our data. Not everything is going to have what you need. So make sure you serve as that scientist. Be the scientist. Make sure you question everything constantly, because the more you do the questioning, the better you increase your chance of success. And what are you looking for? You're going to look for, is what you're looking at effective? Is the intervention you identified effective? Just because it's on a registry does not make it effective. Look into it. Don't just be like the people that read the headlines. Look into the program, the strategy, the curriculum. Read about it. What does the research show? Does it fit? Will it fit the risk factor you identified? If you pick something because it addresses the problem, but it's not really addressing the risk factor, you are not necessarily going to be getting that outcome that you want. And is it something that's a practical fit? Is the intervention feasible for your community? Will it fit your population? Have you taken into account cultural competence? So looking at these, there are a number of different sources. That site that I included here helps you to get a listing of different federal registries that are available. Also, you can look at peer-reviewed journal articles that describe outcomes. I know not everybody gets excited about looking through that, or it's not their cup of tea, but that's why you make partnerships with universities. That's why you make partnerships with groups like our organization, with the Community Coalition Alliance. You have questions about stuff, we would like you to reach out. Together, we can work to look at what the research says, what can we do to best support our communities, and look at things that are documented for effectiveness, not just something that sounds good. The data speaks of volumes, and we need to make sure we're guided by this. The stronger the evidence, the better chance you have of that effectiveness. And make sure that you look and assess things with that critical mind. Make sure you're looking at the evaluations that were done, the methods that were used to collect the data, the effects of the intervention. Does it say it was successful, or did it say it was effective in reducing the things that you're interested in reducing? And are the findings generalizable to the group that you're working in? If not, you can also reach out to the developers. They're oftentimes very eager to work with those that are out in the communities. So registries exist, they're great and they're wonderful, but also make sure that you're looking into the caveats that are said, the limitations that are done, and making sure definitely to consider, is it the right fit for your community? Is it the right fit for the developmental stage? Does it have take into account cultural competence? Will this create any harm or undue hardships as an unintended consequence? All those things are very critical for you to take into account, so that when you start to pick out, and again, this was one of our action motions, so it's supposed to take away the ones that don't have arrows. Once you put your map, your roadmap together for your risk, for your efforts, make sure everything fits together so that all relates going forwards and backwards. And making sure things are appropriate, they're synergistic, they're ready for the community, your community's ready for it, and that you remain culturally competent throughout. Make sure you take all the things that we've talked about. These are so critical to inform the decisions that you have for what's going to be the right appropriate fit for your community, the right program, the right strategy, the right approach. Making sure all the data is considered throughout the process, and ensuring you're doing it as intended, because you're not wanting to take away from the work that the researchers, your scientists have done out in the field. Make sure you evaluate along the way all the things that are happening to inform your decisions. There can always be some outcomes that were not expected, but you won't know unless you're evaluating both process and outcome. Making sure you're building that to increase your next steps so that it all comes together. And with that, I will wrap us up with 1 minute left. I hope that you take away from this the importance of why we say you rely on the research-based and research-supported practice programs and strategies. We hope that you also see the process that takes to identify and select the right program, practice, and strategy, and that how we examine that fits. Please feel free to reach out to us. We thank you for your time, for being here. And if you have any questions, we're here and available. And a big thank you to FATA for allowing us to be here to talk about the importance of selecting the right approach for prevention. Thank you.
Thank you so much, Kathleen. I hope you can see in the chat. Please make sure you're sending to all panelists so you can see what people are saying, and thanking you for all your hard work you've put into this. And just so everyone knows, we've included her contact information so that you may contact her with any further questions that you may have. And a couple of items of business to note before we conclude today's webinar. Please see the chat panel for a link to today's evaluation. Additionally, when I conclude today's webinar, your browser will take you to an evaluation on FATA's website. If you want to receive CE credits or a statement of credit for this event, you must complete the evaluation. You will be prompted to register or sign in to complete the evaluation. You can register as for no cost as a visitor. For CEs to be reported to CE broker for Florida licensed healthcare practitioners, you needed to provide an accurate Florida Department of Health license prefix and number when you registered for this webinar. After you register or sign in, you will be directed onward to the evaluation. You must use the same email address you used when you registered for our webinars and what you have set up in your FATA profile, as this is the only way to connect your attendance. You will get a second opportunity to complete the evaluation through a follow-up email later today. The evaluation will close midnight, Wednesday, February 15th. We do not email statements of credit. Instead, after we verify attendance and completion of the evaluation, a statement of credit will be generated as a journal entry within your profile 30 business days after the evaluation closes. Thank you for participating in today's webinar. We'd also like to recognize and especially thank the Florida Department of Children and Families Office of Substance Abuse and Mental Health for funding today's education. Thank you all and have a great rest of your day. Please see the chat panel for a link to the evaluation, or you will be directed there when this ends. And remember that it closes February 15th. Thank you all.